everyone, it's Michael here with Home Health Success Academy. I just want to welcome all of you guys. So anyways, thank you for joining us for this amazing seminar. We are definitely want to be able to share with you guys some of the best information that I've seen out there that has worked. And also I've done this myself and also researched it and have talked to hundreds of successful marketers out there that have created a successful agency, because an agency is only successful depending on how great their marketing team is. So first of all, I just want to get started and welcome everyone. So if you have never been in one of our webinars before, you guys are going to be up for a treat. So just want to welcome you guys. We definitely want to be able to get started as soon as possible. Remember, this webinar, it is going to be on mute, so we don't hear all those unnecessary background noises from everybody listening. And so definitely want to be able to reach out to you guys, and we're going to be able to discuss a few things before we get started. But before I always start a lot of my big seminars, I always start up with a great quote that I always like. So this quote right here: every morning in Africa, a gazelle wakes up. It knows it must outrun the fastest lion, or it will be killed. And every morning in Africa, a lion wakes up, and it knows it must run faster than the slowest gazelle. So it doesn't matter whether you're the lion or whether you're the gazelle. When the sun comes up, you'd better be running. Very great quote by Christopher McDougall, okay? So pretty much what it says is this. Look, it doesn't matter what happens. When you wake up, you need to be working harder than the other home health agency out there. So if they are a fast home health agency, you better be faster than them, because your job is to create that successful agency. And if you can't do that, well, that's what's going to cause problems. And so we definitely want you guys to be able to learn all the different techniques out there. And so that's what we're here for you guys, okay? So wake up every day and challenge yourself, okay? Challenge yourself. And we actually do this with a lot of other agencies out there that asked us to actually become their virtual marketing manager, where we actually are the ones who their marketers report to be able to keep them in check. We've even had agencies out there that we're helping who we are actually in charge of the administrator or the owner, because they're the marketers themselves, and they want somebody out there that is challenging them. Sometimes we ourselves are our own problem. We ourselves are our worst nightmares, because we prevent ourselves from being able to go out there faster than we can or that we should. So challenge yourself every day out there, okay? I want to make sure, and I want to challenge you guys in doing something. Use an inspirational quote every day when you wake up, okay? When you wake up, there's books that you can buy where they can give you a daily inspirational quote, but make sure it's something about business, okay? Or something about life, because you guys definitely want to be able to have that, okay? So let's move on. Have you ever stopped, okay? I want you guys to think about this. Have you ever stopped to think about the things successful agencies have in common? Have you guys even researched out there what successful agencies are doing? Or is it that some of you guys decided to start a home health agency because you saw your friends have one, or you saw a coworker that worked for one and was having amazing, hours and was able to get a lot of patients? What made you decide to get in this industry? And this is the most simplest question to ask yourself in life, is to, why am I doing this on anything that you're doing? And you want to be able to assess that. So why are you in this industry? Whether you're working for somebody or you started your own company, it doesn't matter. You want to be able to make sure that you answer that clearly. And when you have that clear answer, it's easier for you to be able to be successful. But what we're going to be concentrating more in this website, in this webinar, is to be able to share with you guys what successful agencies are doing out there. What are they doing that are creating success for them? And that's another question. What is success for you? Meaning, what is your monthly census that you want? Or what is the monthly goals that is given to you by your managers and the administrators and the DONs? Like, how many patients are you told that you need to bring in on a monthly basis? Do you have a certain quota? Do you have bonuses if you reach a particular mark? So our goal today is to be able to share with you guys some of the best kept secrets, some of the best knowledge out there that's going to be able to give you guys success for your agencies. Now, the next slide that we're going to be talking about is an amazing information for you guys. And it's going to make sense as we go through the whole webinar, through this whole training series that we're having. It's going to make more sense as we further ourselves down this, okay? So here's the biggest thing that we have to understand, all right? In sales, this is literally a data of information that was put together regarding marketing and sales. And it makes perfect sense, okay? So literally they say 48% of salespeople never follow up with a prospect. And then 25% of salespeople make a second contact and then stop. 12% of salespeople only make 3 contacts, then stop. Only 10% of salespeople make more than 3 contacts. Now, what's crazy is the next set. 2% of sales or success in sales and marketing is made in the first contact. So literally, you dropping by these places, you dropping by the doctors to say hello, to say hi to them, to discuss something about your agency, there is literally a 2% chance of you only getting that business, that service, that referral from these doctors. And so the biggest thing that you need to look in this whole setup is the last line. 80% of all sales and all success in marketing and sales are made on the 5th to 12th contact. So pay attention to that, and I'll be going back into that particular part throughout our presentation on why it is important to know that it takes 5 to 12 contacts before you can actually get a successful sale, a successful marketing, okay? I will touch a little bit on it, is that when you first meet somebody, they don't trust you yet. For you to be able to get somebody's business, for you to be able to start getting referrals, starting getting patients that is going to be referred to your agency, you need to be able to create that relationship with that person, okay? People like themselves, okay? And so it takes time. It takes slowly generating that success with a person for them to feel comfortable around you, for them to know you, for them to ultimately be able to trust you and actually to be able to start referring patients to you. And so I want you guys to pay attention to that. So we want to literally ingrain that into you, that the first visit that you're going to make, that you just dropping off your business card, you just stopping by to say hi, you stopping by to bring those cookies, those donuts, that lunch, okay, is most of the time not enough to develop that trust for them to start giving you their patients, okay? Look, they're trusting their patients' lives to you. So you need to understand that most people are not just going to trust their mom, not going to trust their beloved patients that they've been taking care of for so long just to you right away, and they just met you, okay? So before we get started, let's do this. Turn off your cell phones. That's right, I said it. Turn off your cell phones. And if you're on your computer, which you are because you're watching this webinar, unless you're watching this webinar on your cell phone, then your cell phone should be on. But if your cell phone should be on, I want that to be on airplane mode so you can't receive any text messages. You can't receive any emails. You won't be starting to play Candy Crush or any of that stuff, because every single important information is important for you guys. All right, close those browsers in your computers. Look, the only browser you need to have is whatever is on to be able to have this training on for you guys, okay? No social media, okay? Social media is your enemy. If you are using social media for business, then it's okay. But if you are just using social media, or pretty much social media is using you, then you are making a big mistake, my friend. Next thing is luck. Please focus and be with us here. I need you guys here. I need your attention to be in what I am sharing with you, to be able to listen, to be able to see. If you're kinesthetic, go ahead and write down, these information that is in front of you guys. Whatever it's going to make you feel better. Okay, because I want you guys to learn. There is so much amazing information here that I'm sharing with you guys, and I definitely believe that you guys will come out of this on top and become successful. Next thing is, be the first to answer questions, okay? Answer the questions if I ask you something here. You don't have to answer it out loud, So if you're watching this webinar and we have our suggestion box in the side, if you have that, please make a suggestion, send us an email, send me a text message, anything that you have questions on, I want to be able to hear. So, please do that. I love answering questions through my social media, through my YouTube questionnaires, or through my emails. It's very important for me. But at the same time, answer these questions in your head as well, and what you think I would do, or what do you think a good marketer would do when certain questions come about. So let's see this. Would it be so amazing to have that successful home health agency? Would you want that successful agency? That amazing agency where you have multiple referral sources, not just your one or two referral sources and you're happy, where you have multiple flows of referrals coming in from different aspects. Okay, where you're having them from doctors, where you're having them from hospitals, from nursing homes, from assisted living communities, from word of mouth, from the internet leads. Wouldn't it be amazing to be able to have that? Where you have that agency where your nurses will turn in all their notes. So if you're an administrator, a DON, or a supervisor, you guys know how that feels, where your nurses are not turning in their reports on the time, right? Or at the same time as making sure that when you get the patients, you get them the right way. You get those patients that are qualified for home health services. Wouldn't it be so amazing to be able to have that? Because that is your goal as an agency, is to be able to literally have the right patients, receive them the right way, making sure that you do everything possible. And actually, you really do not violate the Stark's Law and the anti-kickback laws. To be able to get them on the right referral source is the most important thing for you guys. How would that make you feel? How would it make you feel when, you meet that doctor and you're able to get them to trust you with the patients? When you call someone and they agree to speak to you and set up that appointment right there and then. Because that is the hard part. A lot of people have that problem where they call a physician or they call an office or a nursing home and they're not able to get that appointment. They already give you these objections where they say, we're already using a home health agency, or I don't have time to speak to you right now, or it is our policy that we're not supposed to speak to anyone. How would it make you feel if, when everything goes the way you planned it? How we wish that would happen, right? I wish everything happens the way I planned it, but it doesn't. But you need to be prepared for that. And my goal is to give you enough information to be prepared when something veers off. So you know what to do, how to react. You know what to say when somebody says this to you. That's my goal for you guys, is to know how to go past those objections, to go past those gatekeepers with the right items, how to present it correctly, and how to be able to ultimately get past those doors, gain their trust, and for them to start believing you as a person. Okay, so let's go do a quick survey, everyone. Let's do the survey. How many referral sources do you guys want? So let's say, for example, first let's ask this. How many referral sources do you guys have right now? If it's 0, then how many referral sources do you ultimately want coming in? And where are they coming from? Is it hospitals, nursing homes, doctors, word of mouth, internet marketing? So how many referral sources do you want? The next thing is, What kind of census do you want in a monthly basis? I've seen it where people will say, well, I want a census of 50 to 60 a month. I want 50 to 100, 100 to 200. What is it that you want to have? Because depending on how many referral sources you have will also depend on a possibility of how much census you have in a monthly basis. You have to understand, if you are a medical home health agency, typically every 60 days you'll be discharging your patients. So you need to be able to have a great source of referrals coming into the facility. Now it differentiates if you're a private duty non-medical, where typically some of your clients, you will have them for life, for years, 2 years, 3 years, even 10 to 20 years, you never know. So how much do you want? And so to be able to get that number, we need to start off with what your desires are. And later on, if you want, we can further discuss with you guys how to be able to know how many referral sources you need to have to be able to generate 50 clients a month, to generate 100 census a month. So after later on, we're going to go ahead and talk about that. Private message me later on. I would love to be able to speak to you guys. And we definitely want to be able to have that one-on-one talk so I can actually detail this for you. So as we continue on, we discussed several things of what we're going to be learning. But first of all, let's go ahead and get started. And let me tell you something about myself first, so that you can know something more about me. Because I always believe that it needs to get personal, where I love to be able to share my stories with you guys. So my mission really is to help you make an amazing living. So if you're working for a home health agency, I want to be able to show you techniques so you can keep your job, so you can remain working, so you can become that go-to person, so that you can become that person that these agencies will rely on. And if they can rely on you, you're going to be able to get paid well. And if you're the owner, you're the administrator of the company, you can be able to make sure that you keep the doors open of your agency to be able to make sure you have an amazing company. I want to be able to teach you guys to learn how to create a successful agency. I want to be able to help you learn what some of the great marketers are doing in the field. I want to be able to help you learn some amazing marketing techniques, some of the stuff that I've developed myself and that has helped me, and stuff that's been developed and done by other marketers and other successful agencies out there, to be able to give you that information. That's my mission here, is to be able to help you guys, because I'm not going to do my job. I can't do my job if you do not learn, if I don't share this with the community. And that's my job here, is because I want you to learn what are working rather than experience the pain of trying things that are not going to work, and it's going to be a waste of your time. There's two ways of learning. One way of learning is to learn from your mistakes, and that is literally the most, that costs a lot of money. That costs a lot of time. It's better, wouldn't it be better, that the fact that you learn things that are working out there, so that you can cut that time gap? Because the difference between success and where you are is that gap between where you are and success. And if you can shorten that, then it increases your profit. And at the same time, it makes you happy, because you're not wasting any time at all. So when I first started in this industry, I just want to let you know that I didn't have any experience. I did not know much about home health. I actually did not want to get into the home health industry. When I first started in business, my parents have always ingrained in me that, that business is a great thing to have. And, when I grew up, I've seen my parents start businesses. I've seen them create businesses, and I've seen how business can be successful. And I've seen businesses that could fail. But you will never know what is successful until you are willing to try something, okay? So my mom, for example, she literally was one of the, first staffing agencies in Chicago that was owned by a foreign nurse. Okay, so this was in the late 70s and early 80s. And my first jump into the healthcare industry and business was medical uniforms. And we had this idea to start our own brand of clothing, of medical uniforms. And it was funny. We would actually literally cut the pieces, sew them together. I ended up learning how to sew uniform scrubs in the basement of my house. And then we would find buyers for us and distributors. And it was an amazing feeling to be able to have that. And eventually, my first successful business was starting, my one of the first T-Mobile stores, cell phone stores in the Chicago area. And, we were competing against the big boys, and we were literally, starting cell phone packages between 80 to 100 in a monthly basis. And it was amazing how to be able to create businesses that succeeds, to be able to know what are other people doing that makes them successful. And we were doing things that other stores were not doing. I mean, actually, until nowadays, you won't even see that it's being done. I was giving free phones before free phones were thought of. I was giving free earpieces, for free before, everybody else was just including it in the boxes. So this is what made my company stand out then. And what I do is I've included and I've used my business ideas and techniques from outside the industry and brought it into the home health industry. So I'm a nurse by trade. I've been a nurse for more than 15 years. So I've run a staffing agency. I have my own training company where we train CNAs, nursing assistants, and we give them educations. And then I teach CPR certifications as well. I've owned 3 Medicare-approved home health agencies that has included 2 private duty and non-medical, and that is across the United States, not just in one state. And we've done this in other states as well.